How do HIV drugs work? How do antiviral drugs work? Most of the time we know that those people who are taking antiviral drug or HIV drugs, they sometimes go to undetectable viral load. The viral load sometimes remain to zero, negative. So antiviral drugs for HIV work by stopping the virus from replicating in the body, and this allows the immune system to repair itself and prevent further damage. That is how most of the time it works. It works by stopping replication of the virus and thereby helping the immune system to repair and stop the damage of the virus and prevent the further damage of the virus. Now, most of the time we know that also antiviral drug work by reducing the viral load. Antiviral drugs reduce the amount of HIV in the body, also known as the viral load. So it reduces the amount of HIV in the body. Some of them remains to be, now they don't replicate. They don't replicate, and I think after sometimes they become dormant. I said they if they become dormant, doesn't mean that you don't have HIV. They are just in your body and they're just sleeping. They cannot be transmitted. So HIV drugs work by reducing the viral load, and this is by reducing the amount of HIV in the body. It also allows immune system to recover. With less HIV in your body, the immune system can recover and produce more infection-fighting cells, that is the white blood cells and the T cells, and also the lymphocyte cells. So it allows the immune system to recover, and thereby the immune system can produce the more fighting cells that will help you fight mostly the opportunistic diseases. Also, it prevents the transmission. With undetectable viral load, there is no risk of passing infection from one person to another. If you have undetectable viral load, you cannot transmit HIV. That is why you can get couples living, one is HIV negative, another one is HIV positive, and and this one cannot transmit the disease or cannot transmit the virus to the partner. So it is possible for someone who is HIV positive to marry someone who is HIV negative, because the virus, the antiviral drug, prevent the transmission. People having HIV usually take combination of drug, often called highly active antiretroviral therapy. And so sometimes they can take the zidovudine, the nevirapine, and the Septrin, which will the two will help reduce the viral load and help the prevention of damaging the immune system, and the others will also reduce the contacting of diseases and transmission of the disease. Also, the combination drugs is used to increase the potency and reduce the likelihood of the virus developing resistance. If you take one drug, sometimes your body can develop resistance, and you find that you will keep on changing the drug from one drug to the other. So if you use combination, it reduces the resistance. Your body will be able to use that drug for the longest period of time without changing it. Some HIV treatments have been combined into single pill, so you can find nevirapine, zidovudine, Septrin in one pill. In some countries, but in Kenya we use triple therapy. Those that are having drugs, those are taking HIV drugs, they usually get the three combination of drug. Most people taking HIV daily treatment reach to undetectable viral load within 6 months. So if you've started taking drugs today, within 6 months your viral, if you're just taking it well, your viral will be undetectable, and you can not take, you will not be able to transmit the disease. Continuing taking HIV medication as directed is preventive to it will help you to stay undetectable. Yeah, your viral load will be undetectable, and you will live just as a normal person. Yeah, you will live. The only burden that you will have is taking those drugs, but you will live as just a normal person who is just normal, In fact, when I heard some people saying that people living with HIV will die because of HIV, those people cannot die because of HIV. They can die because of another disease, but not because of HIV. Because if they're taking those drugs well, as they have been subscribed for them, and they're following the instruction, they're eating well, reduce stress, lifestyles good, they don't take alcohol, they don't take they don't smoke, yeah, then they will just live a normal life. So someone is living with HIV can live normal life as any other person. So that is what I wanted to say concerning the treatment, the drugs, the HIV drugs. They reduce the viral load, they prevent the transmission, they help rejuvenate the immune system, they prevent the further damage of the immune system. Yeah, that is it. Bye, till next time. Let's meet in the next video.